Well, hello again. Steve Rottmann, Chief Executive Officer here at WISHIN. It's my privilege to lead and moderate this morning's discussion on cybersecurity and WISHIN's business continuity posture to support organizations. This breakout session is sponsored by Cloudticity. Since 2011, Cloudticity has focused on improving patient outcomes by building and managing public cloud infrastructure for the healthcare industry. Their expert cloud engineers have spearheaded projects like the first cloud-based health information exchange on AWS and the first FISMA high deployment on AWS GovCloud. Powered by their proprietary Oxygen platform, they provide tools, expertise, and processes needed to ensure security, compliance, and sustain cloud maturity. Thank you, Cloudticity, for your sponsorship and partnership in this event. I would invite our esteemed panelists to introduce themselves and how they support, their organizations support WISHIN's security posture and position WISHIN to be a business continuity partner to its participants. So first, Kevin Scharnhorst with Health Catalyst.
Yeah, thanks, Steve. So my name is Kevin Scharnhorst, as he introduced me. I'm the Chief Information Security Officer for Health Catalyst. We're a key partner, as you saw in the kickoff this morning for the summit, with the HIE, with the backbone, with KPI, and by Health Catalyst. So that platform is primary in delivering all the data exchange that happens for WISHIN. My team secures all that, right? And so that's what we're here to talk about today. I'm humbled and excited to be with you guys and look forward to answering any questions that may come. And encourage those, don't be shy. So.
And I'm Brian Meyer, WISHIN's IT Director. Won't have as extensive as a background as Kevin here, but work with vendors like Kevin, Heartland Business Systems, to make sure WISHIN's enterprise is set up in the most secure manner. We're doing the administrative, the technical, and the correct things to maintain. Yes.
Was that picture taken last week?
Yeah, right. Thank you.
For myself, Mark Ziesemer with Heartland. Been with Heartland for about 7 years. Prior to that, about 20 years of experience in the industry. Started off in applications engineering, architecture, progressed through infrastructure, operations, networking systems, always increasingly security as organizational needs dictated at the time. Really been focused on security for the past 10 to 15 years or so. Here at Heartland, I'm somewhat uniquely privileged to wear a few different hats across a few different roles on a few different teams. As an original founding member and still an extended part of our enterprise security and risk management team, I'm our information security architect, certified information security systems professional, certified cloud security professional, a few other certifications, Microsoft and otherwise. Here in our headquarters and my home state of Wisconsin, I'm also very honored to serve as a cyber liaison officer or a CLO with Wisconsin Statewide Intelligence Center. And then on the other side of the coin, I help co-lead our Microsoft Cloud Platform practice. So wherever any of these needs of security and cloud and Microsoft combined is typically an area in which myself and my team is working. Just be privileged to be one of more than 400 or more of our technical professionals on our services team, each with their own areas of experience and expertise. As we serve WISHIN as one of our customers, specifically for WISHIN, we are providing them with their XDR platform, our monitoring, our managed services, doing some on-site work with them. One thing that I would highlight too is with a lot of the organizations that we work with, we have many different verticals from manufacturing to government, to education, to healthcare. A lot of those manufacturing, industrial customers, when you walk into their organization, you'll kind of see two sides to the business. You'll see the office side or the accounting side, and then you'll see the shop floor, right, or the manufacturing side. And you typically don't have a lot of crossover between those two, right, for PII, PCI, HIPAA concerns, and similar, right? Similar to a lot of the healthcare organizations that we're working with, WISHIN included. So for WISHIN, we're really operating on that business side, whereas Kevin and team support the more of the operation side. So we're just focused on that smaller side of supporting WISHIN as a organization or a business. But yet, it is that organization that we're supporting and helping to protect. So,
thank you, gentlemen. The goal of this session, and the panelists have touched on it a bit, is to provide assurances, one, to our participants that WISHIN has engaged in partnerships to secure the data that you're entrusting us with as the health information exchange. Also, as our back-end operation systems, that there is another level of security. That WISHIN operates in two different layers. One is through the Health Catalyst KPI solution, where data is fed from our participating organizations. It is completely what we would call sandboxed from our business side, where we have analytics or analysis for specific data sets before it gets into production. Both sides we treat with the highest sensitivity and the highest security. That is why we've partnered with Health Catalyst KPI as a high trust certified organization to do that, and with Heartland Business Systems to, again, implement security solutions, uphold our policies, and monitor and manage in real time. Additionally, to inform you the way the second part of this session is going to inform you of the ways that WISHIN can be a business continuity solution. As we were putting this session together, business continuity that was relative to a number of incidents in the state of Wisconsin, and both cyber and business closings, that we thought this would be instrumental in showcasing what our role can be in providing that backstop. As we looked at the content, and on top of that, the security issues that are coming into the market more and more, representing that security is first and foremost, and then business continuity is second. I do encourage questions. We will have a break between the two sessions, so think of this as a part A and a part B. We do want this to be interactive, but to start off the session related to cybersecurity, we'd like to walk through a couple of slides first and demonstrate and share some of the threats, the protections, statistics that exist in the current marketplace. This will be an informal dialogue as we'll bounce off back and forth here. So some cybersecurity statistics and facts. The average time to detect a breach has been identified to be almost 120 days, 118 days. So think about what can happen in 120 days within an organization. What information can be harvested, what information can be drilled into, then what type of vulnerabilities does that offer to cyber attackers. Additionally, 75% of those attacks, so we talk about our threat vectors being email, 75% of those attacks begin with email. We live and breathe by email communication. Picking up a phone is more inconvenient than sending an email. And as you're in your flow of the day, it's one email to the next, respond, go, knock some things out. That makes it so easy to embed links or just simply opening an attachment that might seem harmless that now can penetrate the organization based on who might open that email. 95% of breaches related to email are human error. So what you'll hear from the panelists often, and I want to speak for them, is people and processes. People and processes. People are going to make mistakes. What protections, what layers does an organization have in place to prevent a single incident to perpetuate through an entire organization? So when you think about the recent incidents, possibly a single person, possibly a single email that took down an entire organization for months. 62% of users have shared a password over email. So I used to be a director of IT, a CIO, whatever you want to call it, and that disturbs you greatly because a part of the people is training. So you have processes to train, but are people being trained effectively? And are those systems and processes being tested for resiliency? 91% of industries have ransomware as one of the top 3 priorities. So now we're seeing the shift with executive level, CISOs, they're understanding or trying to avoid being in any news lead that their organization meaningfully, because it's not really an option anymore. There's meaningful neglect in not offering and implementing the proper security in place. Lisa Berry mentioned that the ONC has re-identified itself and reorganized to be the Assistant Secretary for Technology Policy and the Office of National Coordinator for HIT. That might sound like it's easy to say. It's not when you're standing up here. But the ASTP is moving a focus into cybersecurity, data, and AI. So as she mentioned, they're moving a layer up. It is not about health information technology solely anymore. It's about how that data moves, who has access to it, who's securing it, and I can only imagine what guidance that's going to come of it. That's going to require organizations to attest to new and improved security policies and posture. Gentlemen, anything to add to this slide?
I would just add, I mean, you're seeing governmental agencies like give guidelines, right? They're also tracking vulnerabilities and putting them on a known vulnerability exploit list, right? And those are like important registries to follow so that you can use that to compare. I mean, it's all about, Steve mentioned process and people, but it's technology too, right? So you need to know what is in your asset inventory, both software, hardware, devices and things like that, and comparing those and staying abreast of that so you know when you need to react, right? And also supply chain management, right? We've seen, I don't know how closely you all follow, but like SolarWinds was like a big one probably 3-4 years ago, maybe even longer, but they had a compromise within their own software that they went and developed. If you can do that and they've got a wide customer base, what better way, right? They don't have to compromise an individual, right? Because the software is already being deployed, right? And then they can get a foothold into your organization. So I would just add that on the technology side.
And I can just follow on to the point that you mentioned too about that single email, that single click. This was something that we had discussed a little bit during our call last week. But just ensuring that within your organizations that as part of that shared responsibility between people, process, and technology, making sure that we're not setting up the technology to fail, right? We can't be dependent on that a single person clicking a single email has that power to potentially take down that entire organization, right? In so many cases, there should be the case where someone does accidentally click that link, they lock themselves out of their own H drive or something similar. It doesn't even become an event, right? But too often we're seeing that this happens, a single click, a single email, whatever the case be, and it ends up making news headlines. Just ensuring that you're not setting up the technology to fail. The technology is there as an assistance, but when we talk zero trust, right? Zero trust isn't a thing that you can purchase. It's not a product. It's more of this mindset, right? And, in some of these incidents that happened, I can't even say, right? Was it an IT person? Was it a medical staff? I don't know. But regardless of the situation, it should not have been a situation where it resulted in some of these news headlines that they resulted in, right? So just think about that from a zero trust perspective. Making sure that whether you're an IT professional or you're a medical staff member, that no one person has the ability that you're a single click or an email away of resulting in some of the news headlines that we've seen.
So moving on into some other scary statistics and impacts, there's a cause and effect that happens with not having the appropriate safeguards, and to what Mark and Kevin mentioned, the effects of what that could lead to. A few more numbers here, and again, highlighting the importance of understanding what these impacts are, and then we'll talk about some of the preventative measures that WISHIN and the other organizations have taken to ensure our appropriate posture. 94% of breaches fall under system intrusion. So I'll ask Kevin if you could elaborate on what that means from a system intrusion perspective.
Yeah, so system, and these reports are coming from Verizon. They're famous for an annual report they put out called the Data Breach Investigations Report. And what they classify as an intrusion, and that involves hands on keyboard. So adding on to what Mark said, an email comes in, you clicked, or like Steve said, you open an attachment. That's the vector in, right? You're inviting somebody through the back door, or maybe in some cases your front door, right? But once they're in your system on a computer, they spread to a network. That's what system intrusion is, right? It's somebody taking remote access, through a tool to be able to take control.
Appreciate that, Kevin. These next three bullets support one another. So 90% of reported incidents on the FBI's Internet Crime Complaint Center, IC3, had no financial loss. The remaining 10% of IC3 reported incidents lost in a median of $11,500, ranging from $70 to $1.2 million. Depending on the size of your organization, 1.2 could be crippling, not just from a loss perspective, but there goes your credibility as an organization to secure and manage confidential information. This is what drives WISHIN more than anything, is you are entrusting WISHIN with patient information. The security measures that we have in place and require as part of our contracting with vendors, this is at the forefront. This is the utmost priority. Leading on to this, the second highest breach contributor is miscellaneous errors, human errors, and lack of training. Anything, gentlemen, to add to the human errors and lack of training as the miscellaneous errors identified in the graphs here?
Yeah, I thought that would be interesting to share, right? Because we think about breaches and, system intrusion like we just explained. But, Mark already eloquently explained like the importance of, training your people. And it can't be emphasized enough. So like if, these stats and showing how ransomware were, that high, for this to be the second top, leading cause to breaches, that's significant. That's time for us to wake up, right? And realize what that really means. And there's all kinds of different controls you can do. Administrative would be like policies and procedures, right? And then there's technical controls, like what you do to maybe prevent it. And within technical, there's like detective, There's corrective actions and things, monitoring controls, right? I mean, you need to know when those things are coming into you, but if your organization is not training and spending time, with individuals, you're gonna fail, right? Because you think about how many people work within the organization, it only takes one, right? To be casual, not be attentive to like what's in front of them on their screen. And they do that, right? And if you don't have those technical safeguards like Mark described, the processes or the guardrails to prevent, an unfortunate event from happening, then you're the latest headline, right? And so I can't stress it enough. I mean, you should be having annual, trainings that you go over, content to meet your regulatory requirements, but then educating, right? And every year augmenting that to get better and better. Because not only is it important to train them, but your human asset is, probably the key asset, that you want to focus on, because they're giving you intel too. I mean, you have all kinds of monitoring controls in place that are giving you early signs, but, they're intelligent, have brains, they know behavioral, things that happen on a day-to-day basis. And if something is out of that norm, I trust that above any other kind of technical signal that I get. Right? Because then I can get in front of that and find out, okay, is this substantiated? Is somebody else seeing this kind of pattern? Then I know, right? I can shorten that window, like Steve talked about, 120 days, down to something that I can be more reactionary and be able to lessen the blast radius of whatever's going to happen. Any other comments?
I think the culture is important too. I was reminiscing earlier about a situation happened a couple years after that picture was taken. And the guy was literally standing at Best Buy with gift cards ready to purchase them. And he called the home office, and I was there when operations or AP took the call. And, he was like, where does the CEO want these? What budget code? And we're like, what are you talking about? So he was definitely ready to jump when the CEO said jump. So we've talked with our CEO in staff meetings, he's like, I'm not going to ask you to do something like that yesterday, right? So we're, just trying to keep in mind that, that culture is important, and not, getting people to jump and, get caught in that, that human element or that time sensitivity thing that the scammers try to hook you in with. So.
And the last bullet here is relevant to our industry in healthcare. 68% of all breaches related to cybersecurity are fall within the healthcare market. So this is where we're not looking at like financial data. Where does the money live in banking? Sure, that might be an easy hit, but what can I sell long-term, hold as hostage, which is the data that's most important, is patient information, social security information. I'd add to this, and we'll talk about it a bit more. Those that have children under the age of 13, apply for a debit card today. Go into the credit bureaus and lock those down. If somebody gets a child's credit or social security and information, they can apply for credit and ruin that kid's credit when they're 18 trying to get their own credit cards. This is happening. So it happens with mining for data. During that 120 days, we could ransomware and lock you down as an organization, but I'm also harvesting and selling that information for other purposes. It's happening today. So sidetrack, we're going to bring you back in, but that's a recommendation. If you have children, take a look at that and take it seriously. Protections that WISHIN has in place. And again, this is where we lean strongly as a small and mighty staff that WISHIN is. We need partners to make sure that we're in compliance. We have the appropriate policies. We are in compliance with the requirements of all of our participants, and that per the guidance from ONC, from NIST, from other organizations that we have defense in depth, we have the proper controls, and we're testing the durability of our security. So with that, as I mentioned previously, WISHIN's partnered with Health Catalyst. They are high trust CSF certified organizations. I will ask Kevin to give us a few minutes of what that means and what that provides to the WISHIN network.
Yeah, thanks, Steve. So high trust, for those that may be unfamiliar with, is a certification that is carried out by a third-party assessor. So it's independent from your own organization. And you work with them and high trust too. There's a three-way collaboration to be able to do this, but it's a very comprehensive, you talk about layered security. It's comprehensive in the layers that it does. High trust carries at its core, high trust as an organization doesn't really offer anything, innovative, of their own making, right? At their core, they cross-reference to other frameworks that are out there. And I'm glad Steve mentioned NIST. That's the National Institute of Standards and Technologies, right? A governmental organization, right? For your governmental cloud and other organizations as well. But it's something that many organizations, including Health Catalyst, has latched onto to be able to set standards within our own organizations. And so does High Trust. High Trust maps to NIST 800-53. That's the core framework that a lot of those will cross-reference to. ISO, which is an international standards organization. That's how High Trust got its start. Mapping to those, again, they don't create, they borrow, and they should, right? Why invent the wheel, right? When other organizations have standards that we can rely on. And they mapped to that and they brought that in. High Trust has been around a while. Its history really are kind of rooted with our payers. Many of the boards of our largest payers sat on the board for High Trust, right? And so they wanted to disseminate and push the importance of that. And then, years later, right, healthcare organizations that deliver that patient care followed on to that as well. And that's where we come in today. But the framework itself has 19 different domains, ranging from information security programs, making sure you have a good, hard, solid foundation for your policies and procedures that drive your organization. They have others like endpoint security, mobile device security, network transmission, physical and environmental controls. I mean, it's just an extensive list, right? And again, mapping back to the other frameworks that I mentioned. And so Health Catalyst ourselves has held 5 different high trust certifications, mapping to different products that we offer, right? KPI being one of those. Good news, we're consolidating. That's a lot. Like if you talk to any organization that held it, right, one would be enough, right? And that's where we hope to get to. We're consolidating down to 2, but after a just recent acquisition announced, we'll have 3. So it's always kind of a game of whack-a-mole, right? But yeah, it is the standard, I would say, for healthcare. They're trying to get more renowned throughout the world. It's right now just concentrated in the domestic U.S., but they want to get into banking, and they're starting to gradually get their foothold in other industries, but healthcare is what they serve. And it's a 2-year certification. Your second year is an interim, where they come and just lightly touch it, and they check in on what are called corrective action plans you could have to make sure you're keeping to your commitments that you set in those plans on that second year, and then you recertify every 2. So
Appreciate it, Kevin, and thanks for that work. So WISHIN does not have to do that ourselves, as again, we're not positioned to do that, but our partnership with KPI Health Catalyst ensures that security. With the partnership with Heartland Business Services, or Systems rather, with HBS, we've been partnered with HBS for a number of years. About a year, maybe 2 years ago, we engaged Heartland as we started bringing on additional confidentials and PII into the organization to do the work we need to do, again, before it gets to Health Catalyst. And I'll ask Mark to elaborate a little more on the services that they provide, but touching on multi-factor authentication is enforced. And that doesn't mean so much anymore. And I'll invite Mark to talk about that a little bit. But multi-factor authentication is maybe security of the past and present state, but it's not the future. Microsoft Intune is a way that we manage all of our devices, so where Brian and Mark can talk about this. But the XDR solution is, I think, where the focus and monitoring and management 24/7. They have a security center where they're looking at all of the traffic that's happening in real time. I'm sharing this not to sell HBS services. They can sell their own services. If you're interested, go talk to them. But highlighting that we as an organization are conducting ourselves at the highest echelon so that nothing that is right at the doorstep could be a vulnerability. Now, I'm going to knock on wood because we are not immune to anything. What we're trying to do is prevent those initial inquiries or attacks into the network, and we have the safeguards, notifications, and processes to respond, shut down services if we need to, and also have the backup processes in place. So with that, I'll hand it to Mark and Brian to elaborate on some of the services that Heartland Business Systems provides to WISHIN.
What's valuable to me in these partners is having the bench depth, having not only desktop endpoint security engineers, but on up through SQL, app dev, and so forth. So just knowing that we have a trusted partner with resources there and the subject matter experts to dig into those things that we can't specialize on everything. So that's one important thing and one great part about this relationship. And also, as Kevin had touched on earlier, with the SOC or the Security Operations Center, having the automated AI, the good AI fighting the bad AI, of course, and the automated results, right, in the SIM tool, the security incident and event management tool, and having that human eyes on that as well, right, as Kevin talked about, trusting the alerts and the automation to a point, but then bringing that human element back into there. When I talk to the staff at WISHIN, let's keep the humans in the driver's seat here. We'll have our manual checks, we'll have some automation, and it's kind of like cooking a meal, having a good mix of everything in there. So I'll let Mark talk a little bit more detail.
Thank you. Some of the things I'd covered earlier during my intro. One thing, again, we were talking here in the call last week a little bit about that multi-factor authentication. I agreed with Steve. We have the privilege of working across many different organizations, different verticals, different sizes. And unfortunately, I'd be lying if I said that, yep, everyone is protected with MFA today. 7 or more years ago, that's kind of where I made a large portion of my hour commitment is helping organizations onboard to MFA. Unfortunately, we still have a few that are not there. If that's one of you in this room, let's please talk afterwards, because I would say that's no longer acceptable behavior, especially for an organization that is protecting the healthcare needs of your patients and your customers. What happens though these days instead is, are you using it's a constant moving target, right? The arms race, the cat and mouse game. Are you using the most effective methods of MFA? So in particular, if anyone is still using MFA, I don't care about a cell phone, right? Something like the Authenticator app, the Duo app, something similar on your phone is fine. But if anyone still has MFA tied to your phone number, right? Getting a phone call or a text message with your MFA, again, if you're still using that, let's talk afterwards. You shouldn't be doing that anymore. We talked about NIST. NIST had actually deprecated that as a secure method as early as 2016. As we're looking at the marketplace, years ago, right, people could do the so-called SIM card swapping, right? Just go ahead and steal someone's phone number. Well, attackers are lazy, right? These days for the low cost of $5, extending on this model of everything as a service, there is SIM cards cloning as a service. For $5, if I wanted to get a hold of Steve's number and put it on my phone so I could steal his MFA token, I can pay someone else to do that. So please stop doing that if you're still doing that. The other thing that I would touch on is is anyone here not using Microsoft 365? I mean, most people are, right? Within there's many different levels, different suites, right? There's everything from a business standard, business basic, up to the Microsoft 365 E5, different levels within there. For anyone in this room, right, you probably shouldn't be on a business basic or a business standard. That doesn't give you the tools that you need, many of which Steve has listed up here, right? You don't get in tune on those levels. On those levels, you can only go back and see the past 7 days of sign-in and audit logs. The moment you get on a business premium or higher, we can see 30 days or more. And this, plays into this idea of that mean time to detect, mean time to repair. Within there, what was the figure, right? Over 100 days ago, right? Is that typical dwell time when someone's in your environment? And often if we get pulled in for remediation, we can only see the past 7 days. That doesn't help anyone. To WISHIN's credit, at no point have I or anyone else on the team that I'm familiar with, worked with Steve and said, hey, you should really be doing this. And, we haven't gotten back a nope. I don't think it's a priority for us, right? Security is WISHIN's priority. I wish I could say the same for some other customers that I'm still working with, right? That it's like, well, I don't know if I can spend that extra $6 a month per user to get up to a higher level. That's a price of one coffee, right, for an employee over the cost of a month these days. Sometimes you have to invest in that security.
Appreciate it, Mark. And in a previous slide, to Mark's point, you'll see that there's an increase of, I think the number is 51% of budget investment into security. So that pendulum is moving, because coming from it in past lives 15 years ago, no, we're not going to invest in IT. We'll mitigate that risk some way else. Well, how? Wish and prayers? Because if that's it, that's not going to work. Last point on this slide is, separate from these two organizations, we have a third-party consultant help us write and then audit to national requirements for HIPAA privacy and security. So again, we're sharing this information not to compare or contrast against what anybody else is doing, but again, share with you all that WISHIN takes this seriously. It is important to us in light of all of the things happening nationally and locally with cybersecurity attacks and businesses down for months at a time. We have those protections in place to be reactive. But also, as we move into the business continuity conversation, we are here to help. WISHIN can be a bridge. So not for data and doing what Lisa Berry mentioned. However, we are doing that. When there is an incident, EHR upgrade, cybersecurity attack, disaster or interruption due to any business operations, it could be act of God or some other attack or some type of incident, we're here to help. And we made this a priority for today's conversation, as we've had situations over the past 8 years with hospitals and health systems that I will mention, that we've been able to support. An EHR down issue that was unexpected, within 24 hours, we're enabling users. a recent massive issue. We enabled users, 1,600 users, within a week and a half. What the goal of this conversation and to highlight our position as a business continuity solution is that regardless, again, of what the incident is, we're reliable and we're secure. And for those organizations that are already participants, the contract already exists. You're sending us data. So now, one, you have a backup to your own data from a historical clinical perspective. It is not my system's down, I don't have access to those records. You do in the WISHIN network. Also, access during transitions of care, ambulatory or specialty clinic appointments. Who is this patient? I have no idea. WISHIN's there to help. Again, we can bridge the gap. The note about writing us into a business continuity or a disaster recovery plan is real. Again, the contracts are in place, the data's flowing, and as far as retention and backup solution, let us talk about how we can help you recover some of that data that might be in WISHIN through our partnership with KPI and Health Catalyst as a retention policy. If an incident happens, you're probably, as an organization, going back and back and back to see where did this cybersecurity incident and bit of malware put itself into place, and it might be months and months, or it might exceed a backup that you don't have any. So WISHIN can be that opportunity to take all of that data that you've been sending, because the likelihood that that malware or whatever intrusion point is affecting the bits and bytes of clinical data is highly unlikely. It's built into your systems that we can then push you all of your data back to you into your EHR. So we're real time, we're reliable, we have the controls in place, we have the people and processes in place, and we have that business continuity and backup solution built in. Gentlemen, anything else to add with continuity?
Yeah, the only thing I might add is take advantage of that invite to have the discussion, with Steve and his staff. But I would say the next step, right, if that's something that interests, let's test it, right? Test WISHIN, test Catalyst, right? I mean, and do it in advance, right? You don't want to have it there in your back pocket as a nice idea. I mean, you want to test it, make sure it is going to be a reliable means for your guys' own BCP plans.
So at this point, we can open up for questions.
Yeah. From some of the cybersecurity attacks that happened over the last year, how much insight do you guys have from those incidents or learning about them and cutting edge cybersecurity attacks?
Yeah, really good question. Thanks. So I would say that it's, fair to moderate. A lot will keep these private. And I'll also add on to what, Steve had said about the data that we're learning about. I mean, that report, right, that had breaches, I think I have the statistics. We didn't actually get into the details, but out of 525 incidents that affected healthcare in that last year study, 436 of those had data disclosure. And there's a reason we don't get more details, right? Because, it's early, that needs to be corroborated, right? And to know who all's affected and things like that. So you'll see organizations hold that tighter. But I'll say there's been some good developments as well, right? If you're working with partners that are public, and Health Catalyst is, the SEC just put down rules, right? And granted, there's a little bit of leeway. You have to determine the materiality of it. But they have to be disclosed on a timeline, right? So we'll start to know more about this, right? Be in the public so that we can learn from those types of events as well. But I'll say, in my own experience, those organizations that I've worked with, a lot of it, especially in the HIE world, comes from connectivity. We're supporting VPN tunnels and things like that. between our customers, and their participants. And we learn about those. The first thing we do is sever it, right? Because you want to isolate and not allow any kind of spread. So at that point, we don't know a lot, but after they've worked with a third party, usually a forensic firm, and they fully recovered, we do learn details about it at that point. And, we're also, in security, there's a lot of collaboration that happens, right? We call them indicators of compromise. It's not too long after an organization is affected that they'll share those, and then we look with our own SOCs to see if we have any kind of signals that show that we could have that type of activity on our side. So those types of details do come out.
I'll just piggyback off of a little bit what Dan asked. So we currently contract with WISHIN for pulse and for the DAF product. And we're preparing to report our TDIS 2024 measurement year, and in section 6 of the roadmaps, they're very specific about the cyber attacks and what our organization is doing for supplemental feeds. So really appreciate you talking about the high trust certification, because you'll likely get bonus points on that. But with more remote working and VPN tunnels, do you feel or have any insights into that being part of the breaches as well?
Most certainly. I think COVID came, right, and it changed all of our worlds, right? We soon found out we didn't have to travel to be face-to-face with customers, nor did you have to be in a room, with your colleagues, in your workplace. So certainly, so in cases like that, that kind of goes beyond the edge, like of what, Mark and Steve and Brian have described in the back office types functions. And it's, also impacted Catalyst as well. And so you have to think about those types of connections that are coming in, how you're protecting those. Probably the best thing you can do is implement some kind of a data loss prevention, like a DLP, right, where you're monitoring behavioral, what your norms are, right, and find out what's outside of that, so you've got something that you have to react on. And then again, it's education. I can't stress it more than enough. Your organization should have policies, standards for like what your minimum configurations are for routers, that would have that tunnel egressing and ingressing, back to those home connections. Mark, did well to capitalize on MFA. How you're protecting the connection in, right? You'd have something, which is a password, something that you have, a device or something like that. But maybe even biometrics, right? Maybe like Uber keys and things like that, right? Just to be able to strengthen who's coming in, because an unfortunate thing would be if somebody was able to exploit that, right, and be able to connect into your organization because you're just using the username and password and you're not connecting or following where they're coming from, right? We're not locking it down to IPs, that are coming from those locations because they're managed by ISPs, which are out of our control. So you got to really think about what you can control, because in that equation, there's a lot you can't. Yep.
I would just add to that, as they're handing off the microphone, you're hearing about the convenience over security. What inconveniences am I putting into place as a human process to access and do the job I need over the security that has to be in place to prevent to the level that's possible? And I would ask, my retort to that would be, consider the alternatives. If the process is a bit inconvenient because you might have to go into an app or use some type of device to secure the environment, the alternative is more of an open network, and that when ONC looks at these breaches, they look at different scales. And if your scale is willful neglect because you were informed about it and you didn't put processes, procedures, or technical controls in place, you are going to get hammered. And so that's where we take a consideration of what are the ramifications for us not doing anything, and finding that balance of budgetary constraints, resource constraints, but it's not the bare minimum. It's what can we put in with the resources that we have.
Yeah, and I was just going to add too, I mean, VPNs have been around with us for tens of years, right? Including in healthcare. VPNs, remote desktop solutions were not new to COVID. What you did find is a lot of people that maybe weren't set up with those solutions that kind of rushed into them during COVID. But same thing as part of MFA, Heartland, we have been pulled into customer incident response engagements. Sometimes those findings include that an attacker came in over the VPN. I'm not going to say that by having MFA on that VPN that it would have prevented that, but in every case that I can recall where VPN was involved, too often people are like, well, it's VPN, that's secure in itself, doesn't need MFA. That's not the case, right? Make sure that your VPN is locked down using MFA or certificates or another strong level of access authentication. Another aspect of this too is, I mean, you can watch the movies, read the headlines and other things, and in so many cases, right, it's not the nation state actor that's coming after you, right? They're not using the so-called zero-day exploits. It's not the new and the novel techniques. Certainly those cases do exist, but more often than not, if we were to go back to those statistics, it's organizations that aren't doing the basics. It's not following that basics of the cybersecurity hygiene, and more often than not, that's where people are getting hit.
We are at time, and I want to thank you for joining us and the panelists for the insightful commentary today. Also, thank you to Cloudticity for hosting this this session. We're going to move into what everybody came here for, and that's lunch. Lunch will be in the main room. Help yourself, enjoy. Following that, we'll have other breakouts. Thank you.